The Academy of Neonatal Nursing was established in 2001 with the mission of providing high-quality education for healthcare professionals working across all levels of neonatal care. Each year, the Academy recognizes members of the association with a number of awards and honors. In 2018, the Academy of Neonatal Nursing established a Neonatal Nursing Hall of Fame with the purpose of preserving the history of neonatal nursing and of highlighting the contributions of our many neonatal nursing pioneers. Inductees considered for the Hall of Fame are neonatal nurses who have demonstrated a lifelong commitment to nursing, influenced the path of this profession, and who have made a significant or lasting contribution to the nursing care or health outcome of newborns. This year, we are honored to induct Adda May Allen and Dr. Susan Blackburn for their innovation, influence, and lasting contributions. Adda May Allen is our historical inductee. She is perhaps best known for her creation of the disposable baby bottle liner that can be thrown away after one use. Working as a nurse at Columbia Hospital in Washington, D.C. in the 1940s, Adda May Allen realized that it was exhausting for many babies to nurse using then current bottle designs. While babies sucked on a traditional bottle, a partial vacuum formed, inverting the nipple. Driven by this realization, Adda May Allen designed a plastic liner which allowed the sides to close in as a baby drank milk, thereby helping to limit the ingestion of air. This design was tested out at George Washington University Hospital and later mass-produced by Playtex. From all of us at the Academy, congratulations to Adda May Allen. Dr. Susan Tucker Blackburn is our present-day honoree. She earned her Bachelor of Science Nursing at the University of Connecticut, a Master of Science in Maternal Child Nursing, and a PhD in Perinatal Health from the University of Washington. Dr. Blackburn's storied career includes many awards and accolades, beginning with her early membership in Sigma Theta Tau, the National Honor Society of Nursing, and numerous teaching, academic, and leadership awards. In 2006, Dr. Blackburn was named Distinguished Nurse of the Year by the Washington March of Dimes. She has been principal investigator in multiple research projects on perinatal health and has published extensively in this area. Dr. Susan Blackburn's eponymous book, Maternal, Fetal, and Neonatal Physiology, is a now classic reference which has provided a foundation for neonatal assessment and therapeutic interventions. This textbook is widely used in both neonatal programs and in practice. It provides expert insights into the physiologic changes that occur during perinatal life, highlighting the complex interrelations between fetus, baby, and mother, and the adaptations of the term and preterm infant to extrauterine life. We would now like to offer this brief vignette of an interview between Stephanie Abu, a member of the ANN Executive Committee, and Dr. Blackburn. The full interview may be viewed on the ANN website.
I'm Stephanie Abu, and as a member of the Executive Committee for the Academy of Neonatal Nursing, I have the honor of speaking with and congratulating our latest inductee into the Neonatal Hall of Fame, Susan Blackburn. Susan, welcome and congratulations.
Thank you, Stephanie. I am pleased and really honored to be selected to be inducted into the Neonatal Hall of Fame, and thank the Academy for choosing me. And I'm looking forward to talking with you today. I'm sorry I'm not able to attend the meeting in San Diego.
We would have loved to meet with you in person, but are grateful for your time today so that we can honor your contribution to nursing and to get to know you and your career better. I wanted to start the conversation with really knowing what inspired you to become a nurse.
Um, that's a good question, and it's one that I don't know the answer to. Um, I as long as I can remember, I wanted to become a nurse, and I knew I wanted to be a pediatric nurse. And I asked my family, and they said, "Well, yeah, you always wanted to be a nurse." So I don't know what it was that turned me that way. I don't know if it was, working as a babysitter and as a nanny, maybe got me interested in kids and doing that. But I wanted to go into pediatric nursing. I knew that. The interesting thing is that when I finished my bachelor's, my first job was at New York Hospital, New York City, in their pediatric building. And they put me in the NICU my first day at work, and I never left because I just loved that, and that was my focus forever.
We would now like to highlight some of the numerous testimonials that have been received in support of Dr. Blackburn's induction into the Neonatal Hall of Fame. Dr. Georgia Ditzenberger wrote, Dr. Blackburn's contributions to high-risk neonatal nursing are immeasurable. Throughout her career, she has striven to improve the education and training of nurses within the neonatal field by developing programs for perinatal and neonatal clinical nurse specialists and neonatal nurse practitioners. She developed in her students the ability for critical thinking and inquiry, which continues to impact the care given to vulnerable patients in the perinatal and neonatal period of life. Jeanette Zeichkin provided the following testimonial. Congratulations on your induction into the Ann Hall of Fame. I am among your many students and colleagues who benefited from your commitment to professional nursing education. Thank you for contributing to all aspects of my graduate education, but especially for planting that seed for a nurse authorship that grew into one of the most rewarding parts of my career. Thank you, and congratulations, Susan. Cheryl White and colleagues offered this insight into the impact of Dr. Blackburn. It was 1995. I was a young, enthusiastic neonatal nurse and decided to pursue my master's degree. I didn't have the best GRE score, but Susan believed in me anyways. Susan was simply the best teacher I've ever known. I, along with my sidekicks Heather and Roberta, became an NNP and am now finishing what I consider to be a phenomenal career. I never thank her enough for everything she has taught me. Congratulations, Susan, on a well-deserved honor. Dr. Juliet Campbell added, Dr. Susan Blackburn is a Pacific Northwest icon. She has been responsible for the education of so many of us. She was ahead of her time in many ways and supported many NICU nurses in advancing their practice to become NNPs and CNSs. I owe the second half of my NICU career to Dr. Blackburn and have been privileged to expand and grow both personally and professionally as an NNP. Congratulations, Dr. Blackburn. You totally deserve this honor and so much more. Dr. Jane Sweeney wrote, in addition to her extraordinary contributions as a scientist and professor, Dr. Blackburn's personal example of altruism is inspiring. She always makes time to listen, assist in problem solving, or explore new program designs without expecting anything in return. This generosity of spirit is extraordinary. Finally, we would like to offer this tribute by Dr. Carol Kinner.
Susan, congratulations. This is wonderful news that you have received this award. No one deserves it more. You have touched the lives of so many mothers and babies and made neonatal nursing and maternal child care better. Keep up the good work. You are my hero. And again, congratulations.
All of us at the Academy extend our sincere congratulations to our Hall of Fame inductees, Adam A. Allen and Dr. Susan Blackburn. Enjoy the conference.